Hi, I'm Nurse Barb, and this is your daily dose on men's health and erectile dysfunction, or ED. So, what is erectile dysfunction? It means that men have trouble having an erection and maintaining an erection, and we'll call it ED throughout this video. And why is a women's health specialist talking to you about this? Well, a lot of my patients who are partnered with men come in because they're having sexual issues and they're really not sure where to start to help solve them. So let's break down what erectile dysfunction and ED is. You know, the penis has a lot of very, very small blood vessels, and these blood vessels need to pump enormous amounts of blood into the penis so that it can become engorged and erect. And if there's any issue with those blood vessels, well, it's very difficult to get enough blood to get into the penis and stay there so that the penis can be erect and stay erect. And so if there's a blood vessel issue, that can cause erectile dysfunction. And that's why I have this blood pressure cuff behind me, because men who have high blood pressure or men who take medications for their blood pressure often find that erectile dysfunction is one of those side effects that they weren't really anticipating. So we know that those small, tiny blood vessels in the penis are really an indicator of what's going on in blood vessels throughout the body, especially the blood vessels in and around the heart, because those are also very, very small. So if men have atherosclerosis or a buildup of plaque in those tiny, tiny blood vessels around the heart, they can also have plaque buildup in the penis arteries and blood vessels, and that can impede or interfere with the blood flow that can lead to a nice, healthy erection. What else can impact men's ability to have an erection, or what causes ED? Well, we know that age is one of the issues. In fact, 25% of men who are between 50 and 59 will have some degree of ED. And by the time a man is 60 to 69, that number goes up to 40%. There's other things that can impact those very delicate small blood vessels, including diabetes, because diabetes affects all of our tiny blood vessels, and it can make it more difficult for that blood to get where it needs to go. We know that obesity is also a factor. So a lot of men will say, gosh, if they're looking down and they can't see their toes, or they can't see their genitalia, that's a sign that maybe their tummy is too big, their belly's too big. That's a sign of obesity, and that can also impact whether or not a man can have an erection. We know that there are certain medications that can increase the risk of ED. Now, for many men, they're taking medications for male pattern baldness. And they're like wondering, well, they're reading about the side effects that it can cause issues with their sexuality. And they're trying to think, well, what's worse, losing my hair or not being able to have an erection? But I want to reassure you that when we talk about risks and side effects with medication, not every man will have those side effects. So if you're taking medication for male pattern baldness, what that does is it impacts your dihydrotestosterone, and that can impact your sex drive and also your ability to have an erection. But it doesn't happen to all men. So my advice is, if that's been prescribed for you, give it a try, see how it works, and see if it impacts your sexuality. Another thing that comes up a lot is depression. Many men who are depressed find that their sex drive is quite low and they are having trouble with having erections. And then they're advised to use antidepressants. And they're, again, wondering, well, what's worse, being depressed or using medications that can impact their sexuality? Again, I would say talk to your healthcare provider, but if you're depressed enough to need an antidepressant, it might be a good idea to take that, see how it impacts your overall life, your overall sense of joy and vitality, your energy level, because many men find that once they are working on their depression, their interest in sex increases, their interest in exercise increases, and that makes them more likely to want to have sex and be able to. And that brings up an important point. When men don't have the energy to exercise, they're not increasing their testosterone levels naturally, because exercise, using our muscles, increases testosterone levels. And when you increase your testosterone level, it increases your sex drive, and it makes it more likely that you'll be able to have an erection and be able to keep that erection. So exercise is super, super important, but there's a couple things to remember. It's kind of like Goldilocks. It can't be too little, it can't be too much, it's gotta be just right. So with exercise, if the only exercise is couch surfing or playing video games, that's not enough exercise to work your muscles and increase your testosterone. But if there's running marathons every weekend or exercising for more than 4 hours a day, that can also decrease testosterone levels and make erectile dysfunction more common. Are there any exercises to avoid? Well, for centuries, it's been known that men who ride horseback for long periods or who are on bikes for more than 4 hours, they may, not always, but they may have issues with all that pressure on that very delicate genital tissue, and they may have some ED associated with that. So those are some of the issues that can lead to erectile dysfunction, but what do you do if you suspect this is an issue for your male partner? Because this is a highly vulnerable, highly personal and very private issue that men do not ever want to talk about. And this is how it comes up for many of my patients. They say that when they go to give their partner a hug or they want to just rub their back, their partner brushes them off and they feel rejected. And qualitative research, when we interview men and talk about it, many men say, well, I know I can't get to the finish line, so I don't even want to get started. And I don't really know how to talk about this with my partner. There's so much vulnerability and so much shame around it that many men would rather just not deal with it, not talk about it. And this can leave their partners kind of wondering, well, what's really going on? And that's where they come to see their women's healthcare provider and they're asking us. And so one of the first things to do is to just be reassuring that this is a very, very common issue. In fact, remember 25% or 1 in 4 men over 50 are having ED, and that number rises to 40% by age 60. So it's a very common concern. The second thing is we want to create a safe environment to talk about this with our partners, because after all, many women are the healthcare managers for the entire family and do manage their male partner's health. So we want to create a safe environment and use open-ended statements or questions like, you know, I love all of you, not just when we're having sex. And I'm a little concerned and worried because I feel like whenever I go to touch or hug you, it seems like that's not a safe thing for you, and you shut everything down. Is that something that you want to talk about? Maybe we can get you set up with your healthcare provider. It's important to create that safe environment where you're not rejecting your partner because they're not able to have an erection, but looking at ways that can investigate what's going on and then look at options for treatment, because many men are really surprised to learn that some of the treatments are super simple, super easy. Sometimes it involves taking medication, sometimes it's lab tests to find out what medication is needed. And then oftentimes, if a primary care provider can't help, then we refer on to a urologist or a men's sexual health specialist. So if you or someone you care about is dealing with erectile dysfunction, don't give up. And don't just brush this aside and ignore it, because you're way too young to stop having intimacy. You know, sex doesn't have an expiration date. So do talk to your healthcare provider and do get the information you need. Now, if you like this video, please click on like and subscribe. And for more information, you can go to my blog, nursebarb.com. I hope this has been helpful. Take care and be well.